who should actually get tested for osteoporosis, right? It's probably makes sense, like with most health things, that not everybody needs to get tested. So who should get tested? And if you've watched most of this podcast so far, you're probably getting a good idea of if you should get tested. Any woman over 65 years old, it's probably a good idea to get tested, as you're getting into that senior category, that elderly category, becoming an older adult. The chances of you developing it goes up tremendously, specifically if you're a woman. Also, any woman who is at an increased risk. We talked about women earlier who are at a very low body weight, not physically active, or are simply too active, so they might be doing too much where maybe they lost their period. Again, we talked with the period, messing with the hormones in your body that help with bone health, so some things you need to be considered. Also, another high-risk category, individuals who are on a large amount of medications that I saying promote osteoporosis. Of course, we don't want anything to promote osteoporosis, but if it does conflict with the absorption of different nutrients, it leads to less body weight, it leads to hormonal issues. Of course, those things are going to increase your chances of getting osteoporosis, which, if you are, again, we're talking about now people who should get tested for osteoporosis, this would probably be a good category. Younger women and older men should consult with their physician, and actually all these categories should consult with their physician. This is just kind of my general knowledge of what I've learned so far. The higher the risk, the more often you should get tested, and the potentially more serious of treatments or focused of different things you should do to actually help to decrease the chances of getting osteoporosis for yourself. So who should get tested? At some point, probably everyone should, but if you're at those really high-risk categories, it'd be a great idea. And just go talk to your physician just in general. Maybe you're not even concerned about it, but you are concerned at one point about it. Most of us, thank God for modern medicine, are going to live to potentially 80, 90, 100, no problem nowadays. So with that said, though, just because we're living longer, it doesn't mean our quality of life is going to be better, and things like osteoporosis can actually come from that. So just be mindful of this, and if it is something that is concerning for you, and if you fall into those categories, make it a priority for yourself. And if you're finding value from this video, please consider liking it and sharing this with others. So the next portion of who should get tested, so we talked about who should get tested, but what do they do when it comes to a test, right? So, when it comes to bone mineral density, it's like, how do you test it? My bone's in here, like, it feels hard, right? Is it a strong bone? So what they actually do is this thing called a DEXA test. It's basically a bone scan test, and DEXA, or dual energy X-ray absorptiometry, is essentially a low-grade X-ray that goes over your whole body, and it can actually tell how thick or how dense or how much bone mineral density your body has. And this is actually a really cool thing that is used for individuals who are getting their body fat tested as well. It scans your whole body, and you can see different areas that have fat mass. In maybe your right leg is more fat than your left leg, and you have more muscle in your left arm than your right arm. It's a really cool thing, and it actually does the same thing for your bones too. So it scans your body, and what it does is it gives you a T-score, and a T-score is essentially a comparison of what your bone is compared to healthy bone of individuals that are, as we talked about earlier, in that peak bone mineral density range of about 25 to 30. You're comparing the healthy your bones with the T-score to bones of that healthy, early adult area. So the scores are based on healthy bones. So when it comes to your T-score, it will come in basically a number from, it can be very wide, but I've seen some that are like -4. I've seen some that are 4. Basically, a +1 to a -1 is what is considered a normal or healthy bone. So if you come back from your DEXA scan and your T-score is +1 to -1, you're good, right? If it's, let's say, 0.5, you're good. If it's 0, you're good. Just know it's that different range, right? Individuals, and also I should say the higher it is, the better too. So once you get to -1, that's kind of the lowest barrier you want. After that, -1 to -2.4 is considered an osteopenic bone, which we'll talk a little bit about the difference between osteopenia and osteoporosis in a second. And then -2.5 and lower is a osteoporotic bone, or a bone that has developed osteoporosis. And one of the really cool tools that they have out there is called an FRAX tool. And this is a fracture risk assessment tool. Basically, it can use a 10-year likelihood of minimal trauma fracture. So you take this little assessment and it'll give you a 10-look outlook on how likely are you to fracture yourself. And I haven't actually looked at this test because it's only available to providers and I don't really do stuff like these with individuals. But I would guess the test or the different screening would have something like, what is your current physical activity level? Do you do high impact activity? Do you smoke? Do you eat a diet high in calcium or vitamin D? Do you get enough sunlight? All these different things that can help with bone health. It's probably screening those things and can give you a 10-year outlook, which is really cool because guess what? If you do take this assessment, you won't have to use a DEXA scan. So as we mentioned earlier in the podcast, if you're somebody who's maybe still interested on, am I at a higher risk for developing it in the future? This would be a good assessment tool for yourself. So if you're maybe a premenopausal woman, or even if you're postmenopausal but still feel like you're active and okay, this could be a really good thing for you to test.